Hello everyone, welcome to Dental Mate. Today in this video, starting up with the salivary glands, we'll be talking about a major salivary gland and a most important one, that is the parotid gland. Let's get started. So, if we talk about a brief introduction of the salivary glands, there are three major salivary glands and many or numerous scattered minor salivary glands. The major salivary glands are a predominantly serous gland, which is the parotid gland, a mixed gland, serous and mucus, which is the submandibular gland, and a predominantly mucus gland, which is the sublingual gland. So, parotid gland, it forms the most important LEQ for all of us. Let us talk about the parotid gland. It is a major organized salivary gland having a serous secretion, and it is the only salivary gland which is ectodermal in origin. Now, if you talk about the location of this gland, then it is located below the external acoustic meatus. It is located behind the posterior border of the ramus. See, if we trace this, this is the border of the ramus, posterior border of ramus. So this is located behind the posterior border of ramus, below external acoustic meatus, anterior to the sternocleidomastoid muscle, and it is present deep to the styloid process. So this is how we define the location of parotid gland: deep to styloid process, below external acoustic meatus, behind the posterior border of ramus, and anterior to the sternocleidomastoid. Okay, there is an accessory parotid gland which is also present or also seen at the junction of the posterior and the ramus and the body of the mandible. Okay. Now we have the Stenson's duct. What is how is this Stenson's duct seen? See, this is the main excretory duct of the parotid gland, also known as the parotid duct. The Stenson's duct is the main excretory duct of the parotid gland, also known as the parotid duct. See, this is thick walled and it is about 5 centimeters long. It opens in the vestibule of the mouth opposite to the crown of upper second molar tooth. Opposite to the crown of upper second molar tooth, there is the opening of the Stenson's duct. It has an oblique course through buccinator, and the inflation of this duct is prevented during blowing. So, this we have discussed up till now. What all things? We have discussed the location of the parotid gland, where is the accessory parotid gland present. Along with that, how is the course of the Stenson's duct and the secretion and the origin of the parotid gland. Now let us talk about the gross features of the parotid gland. So if we see the features of the parotid gland, it has 3 borders and 4 surfaces. Okay, what are the borders of the parotid gland? First of all, this is the base. See, we have the anterior border, the posterior border, and the apex. So the parotid gland has a base and the apex, anterior border, posterior border, also the pharyngeal border or the medial edge. This is the cross section of the parotid gland. क्या क्या होता है parotid gland में? Anterior, posterior, pharyngeal border या फिर उसको medial edge भी बोलते हैं. So it has 3 borders and 4 surfaces. What are the surfaces? We have an anteromedial surface. We have a posteromedial surface, superior surface, that is the base of the mandible, and a superficial surface. Okay, these are the 4 surfaces of the parotid gland. Next, if we talk about the capsule of the parotid gland and its speciality. So, the parotid gland capsule or the fascia, it is tight and unyielding. Okay, the fascia of the parotid gland, it is tight and unyielding. See, it is two types of capsules, that is true capsule and false capsule. First of all, we have the skin covering over the parotid gland. Now this is the true capsule. What is the true capsule? See, it is an inner thin capsule formed by the condensation of the fibrous stroma or the connective tissue of the parotid gland. This is the true capsule. And we have a false capsule. It is the outer thick parotid sheath formed by the splitting of the investing layer of the DCF. So डीप सर्वाइकल फेशिया का जो इन्वेस्टिंग लेयर होता है it splits and it gives rise to the false capsule, which is a thicker capsule, whereas true thin capsule, it is formed by the condensation of the fibrous stroma of the parotid gland. Next, if we take a horizontal section of the parotid gland, ठीक है, तो हमें एंटेरोमीडियल पोस्टेरोमीडियल पोर्शन. Okay, so now if we look at this horizontal section through the parotid gland, we'll see the structures related to and the structures piercing through the parotid gland. Okay, so we have the superficial surface. Along with that, we have the superior surface, the anteromedial and the posteromedial surface. Let us see what are the structures related to this. First of all, there is a skin which is covering the superficial surface, and there are numerous branches of the great auricular nerve along with superficial group of lymph nodes or the parotid lymph nodes which are present here. Certain lymph nodes are present or related to the horizontal when the horizontal cross section is cut. So the stylomastoid foramen is related in the posteromedial area, and the branches of the facial nerve are emerging through it and moving, piercing the parotid gland. We have the internal arteries. Let us see what are the arteries related to it. We have the internal carotid artery, external carotid artery, and the maxillary artery. Veins, we have internal jugular and the retromandibular vein, which is related to the parotid gland. See, let us talk about the muscles which are related to the parotid gland. In the posteromedial surface, related to it is the mastoid process, and it is the sternocleidomastoid and the posterior belly of digastric muscle which is attached to it. Next, we have the posterior ramus along with the masseter muscle and the medial pterygoid muscle which are attached to it. Then it's a styloid process, the stylohyoid, stylopharyngeus and the styloglossus muscle attached to it, forming the styloid process. So these are the relations which are seen. These are the structures which are related to the parotid gland or the relations of the parotid gland. Next, if we talk about the structures piercing the parotid gland, it is the from outside to inside. It is so from inside to the outside, if we look, it is the external carotid artery, the retromandibular vein, and the facial nerve. First up is the facial nerve. See, this is the facial nerve. This gives out two branches, that is temporofacial nerve, cervicofacial nerve. Cervicofacial nerve gives out two branches, upper buccal, lower buccal, then marginal mandibular and the cervical branch. Okay? The temporofacial nerve divides into two, the temporal branch and the zygomatic branch. So the facial nerve, which is a structure passing through the, this is the course of the facial nerve, which is a structure passing through the parotid gland and the branches that give out along its course through the parotid gland. Next is the artery, which is the external carotid artery. So this external carotid artery, it gives a branch, that is posterior auricular artery, and a main branch, that is the superficial temporal artery. Through its course, it also gives out the maxillary artery, the transverse facial artery, and this external carotid artery is the blood supply for the parotid gland. The structure another structure piercing the parotid gland is the retromandibular vein. Let us look at its course, we have the superficial temporal vein. Then it gives out the transverse facial and the maxillary vein. After that, we have the internal jugular vein, the common facial vein, and the external jugular vein. So, the superficial temporal vein, see lateral mandibular vein का सबसे पहले है superficial temporal, उसके बाद दो branches है transverse facial and the maxillary vein. After that, it divides into two, internal jugular, external jugular. Internal jugular, when it is divided into its internal jugular, it is giving another branch which is the common facial vein. When it is divided into external jugular, it is giving another branch which is the posterior auricular vein. So the external jugular vein, it is the venous drainage of the gland. Now if we talk about the nerve supply of the gland. So parotid fascia की अलग nerve supply है और जो parotid gland है उसकी अलग nerve supply है. पहले parotid fascia. It is supplied by the greater auricular nerve. Now parotid gland, it has two supplies, sensory and motor. The sensory supply is by auriculotemporal branch of the mandibular nerve. अब हम उसकी वेजोमोटर या फिर सिंपैथेटिक सप्लाई देखते हैं. देखो, मोटर सप्लाई में वेजोमोटर, सिक्रीटोमोटर. The vasomotor supply is the sympathetic supply, whereas the secretomotor supply is the parasympathetic supply. See, we have the inferior salivatory nucleus, which is present in the medulla. From there runs the preganglionic fibers, giving the branches to the glossopharyngeal, tympanic branch of the ninth cranial nerve, then the tympanic plexus and the lesser petrosal nerve. After that comes the terminal bouton, in which the fibers are relayed in the otic ganglia. Then are the postganglionic fibers, which are the main supply to the which is the main secretomotor supply to the parotid gland, which is via the auriculotemporal nerve. After that, we have the vasomotor supply or the sympathetic supply to the parotid gland. It is via the postganglionic fibers from the superior cervical sympathetic ganglion and a plexus around the middle meningeal artery. Next, if we talk about the lymphatic drainage of the gland, then the afferent lymphatics are drained via the superficial or the parotid group of the lymph nodes, that is paraparotid and the intraparotid group of lymph nodes, and the efferent lymphatics are drained by the jugulodigastric group of deep cervical lymph nodes. Next, if we talk about the applied anatomy of the parotid gland, we have first of all the viral parotitis. It is a mumps, which is the viral parotitis. It is a complications. इसके complications क्या क्या हो सकते हैं? Orchitis, pancreatitis. Next, we have parotid swelling, which is very painful because of the unyielding nature of the capsule of the parotid gland. Next, we have the parotid abscess. So one thing, if we talk about the parotid abscess, we must remember that it is best drained by the horizontal incision, which is known as the Hilton's method. Next is the parotidectomy. See, via parotidectomy, one thing we need to remember is the facial nerve, it should be always preserved, while and the gland, the parotid gland, it should always be removed in two parts, that is superficial and deep part, so that we can preserve the facial nerve. Next is Fraze syndrome or the auriculotemporal syndrome. What happens is when the auriculotemporal and the great auricular nerve joins, then the sweat gland stimulation and hyperemia is together seen. So when the person is eating, the sweat appears on the face instead of saliva. There could be a mixed parotid tumor which could be seen associated with the parotid gland. It is a slow growing lobulated painless tumor without the facial nerve involvement. So this is it about the parotid gland. Do not forget to like, share and subscribe to my channel. Do hit the bell icon if you don't want to miss any latest updates. Also, let me know in the comment section below if this video has helped you in any ways, as this would boost me to make videos of even better versions for you all. Stay tuned, keep visiting, thank you. This is it about the parotid gland. Do not forget to like, share and subscribe to my channel. Do hit the bell icon if you don't want to miss any latest updates. Also, let me know in the comment section below if this video has helped you in any ways, as this would boost me to make videos of even better versions for you all. Stay tuned, keep visiting, thank you.